Have you ever experienced a night where your mind just will not shut off, replaying events or buzzing with anxiety, making sleep impossible? For many, this is not just a bad night, it is a persistent struggle that can feel overwhelming. Post-traumatic stress disorder, or PTSD, and insomnia are deeply intertwined, creating a challenging cycle where each condition can worsen the other. This means that if you have PTSD, you are very likely to experience insomnia, and persistent insomnia can also intensify PTSD symptoms. The core of this connection lies in how trauma affects the brain's stress response system. PTSD often involves hyperarousal, a state of being constantly on high alert. This keeps your body's fight or flight system activated, even when you are safe. When it comes to sleep, this hyperarousal makes it incredibly difficult to relax, quiet the mind, and fall or stay asleep. Nightmares are also a very common PTSD symptom, often reliving traumatic events, which naturally disrupt sleep and can make someone dread going to bed. The brain struggles to process and consolidate memories during sleep, especially with PTSD, leading to a fragmented and non-restorative sleep experience. This lack of quality sleep then further impairs emotional regulation and cognitive function, making it harder to cope with PTSD symptoms during the day. It is a true bidirectional relationship. Poor sleep makes PTSD symptoms worse, and PTSD symptoms make sleep worse. For instance, the amygdala, a part of the brain involved in processing emotions, can become overactive in PTSD. This heightened activity can interfere with the natural sleep stages, particularly REM sleep, which is crucial for emotional processing. Understanding this connection is the first step. If you are struggling with both PTSD and insomnia, it is important to speak with a healthcare professional. They can help you identify specific sleep disturbances and how they relate to your PTSD symptoms. Keeping a simple sleep diary, noting when you go to bed, wake up, and any disturbances, can provide valuable information for your doctor or therapist. This is not about self-diagnosis, but about gathering data that can help guide a professional conversation. They can then explore integrated treatment approaches that address both conditions simultaneously, which is often the most effective path. Interestingly, research shows that treating insomnia can sometimes lead to improvements in PTSD symptoms, even before directly addressing the trauma itself. This concept is sometimes referred to as sleep-first approaches in trauma recovery, highlighting the foundational role of restorative sleep. One specific example is cognitive behavioral therapy for insomnia, or CBTI, which is a highly effective, evidence-based treatment that teaches you strategies to improve sleep habits and thoughts about sleep. It can be particularly beneficial for individuals with PTSD because it helps to retrain the brain's response to sleep cues without directly engaging with traumatic memories. Recognizing the powerful interplay between PTSD and insomnia empowers you to seek comprehensive support. By focusing on improving your sleep environment, understanding your sleep patterns, and engaging with professional help for both conditions, you are not just treating symptoms. You are building a stronger foundation for healing and regaining control over your well-being. It is a journey, and every step towards better sleep is a step towards managing your PTSD more effectively.